this is a small little lower back exercise program that we tend to give people. This is of course done on top of any of your core exercises and stretching that you might also be doing. Remember, we've got to always be activating our pelvic floor and our core muscles during any of these exercises. So if you don't know how to do that, by all means call us at the clinic or find out next one of your appointments how to be ensuring that we're activating those muscles appropriately. So these exercises are excellent at turning on the core. They don't take long. You're looking at only about sort of 4 to 5 minutes, and you just do that morning and evening. So let's run through some of the exercises first. The first exercise is the dead bug. So we just simply lay down on our back, okay? Now, a lot of people who will be doing this will have sore backs. So when we do it, rather than just lifting both your legs up at once, that puts a little bit of stress on the lower back. I always like people to bring one leg up at a time and then bring our arms up. This is why it's called the dead bug, because we're in that dead bug type position. I don't know if anyone's seen a dead cockroach, but this is what they look like. So basically the first exercise is opposite arms and opposite legs. So we simply just opposite arm, opposite leg, going out into a nice straight position. The key here is to make sure that we're reaching for the top corner of the room with our foot and reaching for the top corner of the room with our arm. And when we do that, really reach for it like you're trying to touch it, that turns on the core. The important thing is, whilst we're doing that movement, making sure the other arm stays still and this knee stays on this side of the hip, okay, stays towards your head. Alright, and we hold there for a couple of seconds, like 2 or 3 seconds, and then coming back to the centre. And then we alternate to the other side, again reaching up as high as we can, clenching on through the core, and that makes sure that we're activating all those abdominals and the deep muscles at the same time. And we come back again. And we just keep alternating in this fashion, back and forth. We do about 10 of them all up, okay? If you wish to do more, you can do more, but I always like people to start with 10, and then we build up from there, alright? One of the mistakes also that people make with this is they tend to drop their legs too low. So we only want to go on that nice 45-degree angle, and that optimises the core activation. Now, from this position, whilst we're here, we like to transition into another exercise, which we call the counter rotations. Now, you'll see from the angle that you're on there, that when we counter rotate, my arms go one direction, the legs go the other way. My hand only comes to the midline of my body. My opposite knee comes to the midline of my body. We hold there for a couple of seconds and then back to neutral, and then we counter rotate the other way. Again, the opposite hand now coming to the midline and the opposite knee. We hold there for another 2, maybe 3 seconds, up to 5 seconds, and then back to the centre again. Notice during this whole process, my knees are staying towards my head of my hips. It's a really important thing. As soon as they start to drop down, you'll start to feel it through your hip flexors. That puts extra load on the lower back, and of course that's going to increase the risk of the exercise. So holding form and good technique is extraordinarily important for this exercise, and doing it really slowly, not trying to twist too far. That's the other mistake people make. We want to go back and forward, nice and neutrally there, keeping the abs on and choosing to use them. Now, when we come out of the dead bug position, we always make sure we put one leg down at a time and the other leg down at a time, and then we're in a nice relaxed position. Whilst we're here, this is a bit of an option that sometimes I don't always get people to do, but whilst we're here, we can do some little ab crunches or little baby crunches, alright? So from this position, we can put our hands up. I like to put the thumbs on the cheeks and the fingers above the eyebrows, and it creates like a nice little bracket here, which then allows us to lock the neck in position. And then we crunch up and crunching back down. Working nice and slowly, you can hold there for a second or two and really work those abdominals, and then lowering back down. Crunching up, squeezing the abdominals, and then lowering back down. Okay? Of course, your legs are always bent in a nice comfortable position throughout this exercise. You know, you don't want to have your legs straight because that puts undue stress on the back. If you like, you can put them up into a position like so, and that also, once again, still protects the back. And we crunch up and hold, and back down again. So there's a few different options with that one as well, but it's an excellent little exercise, and I'd get you to do around about 10 of those to ensure that we're working the abs nice and slowly and control all of the movements. Always adding a little pause at the end there just to make sure that we're really working the muscles. Then from this position, whilst we're here, now this exercise is the main reason I'm not using a pillow, and you'll see why in a moment. We call this exercise the the single leg glute bridge, okay? So a normal glute bridge is with our hands at our side and we lift up and back down again. Up and back down. Now a glute bridge, we've got to make sure we get a nice straight line here. That's the important thing. Now a single leg version uses your core a lot more than just your glute muscles. And which is obviously the main reason we're doing this exercise. So what we do is we straighten one leg out and then just have it roughly on the same angle as the thigh of the other leg. Hands are at our side, neck's in a nice relaxed position, and then basically pushing down through the heel. So you can see during this I can actually bring my foot up off the table and we push through the heel until we get nice and straight. And we hold there for around about anywhere from 3 to 5 seconds and then dropping back down. And then we alternate across, swapping legs, lifting up, pushing through the heel, holding there for another 3 to 5 seconds, and then back down. And we'll alternate back and forth like so. If coming up on 2 legs is a little bit too much, or it hurts your back or anything like that, then sometimes what we can do is we can come up with 2 legs, go into a 1 leg position, holding, back to 2 legs, and then back down again. And then up again with 2 legs, and then go on to the opposite side. Alright, and back down again. So sometimes one of the main reasons that people get a bit of a pinch in their back when they're doing this exercise is because they hyperextend their back. They lift up and arch too much. So rather than sort of arching up and then lifting and running the risk of injuring our back, what we like to do is set the pelvis or set the core and squeeze the abdominals, have the arms nice and relaxed, and then lift up, and that eliminates that risk of arching the back and damaging things. So the next exercise after the glute bridge is what we call the lateral leg raise. So we lay on our side, having a pillow or just using your arm if you're on the floor. I like the bottom leg nice and relaxed in that type of position rather than fully straight, and then we straighten up the other leg on top of it. We've got to make sure that our bodies roll forward appropriately so that we're in a nice straight line. And we're actually going to be using the glute medius and the upper glutes to really facilitate this exercise here. So the lateral leg raise looks a little something like this, keeping the toe pointing towards the ground, leading with the heel is what I often like to say to people. As we lift up and hold for a few seconds, anywhere from 3 to 5 seconds, and then back down again. And then lifting up, hold for 3 to 5 and back down. You'll notice as long as I keep my foot turned inwards and my whole leg turned in, that keeps my body forward, which really makes me use this part of the muscle here, just behind the hip in the bottom. One of the big mistakes that everyone makes with this is they turn their toe up and then lift up. And what happens when you do that is you can lift up really high, which everyone thinks is a good thing, but the problem with that is it starts to use the muscles around the front. So you don't actually use your glutes at all. You're using some of the hip flexors and some of the other lateral stabilizers of the hip. We want to really make sure we keep that leg turned in, squeezing up, and really using the glutes as well as we can. Alright? Try not to also hike up through the lower back as well. Keep that core on and really lock things and making sure in a straight line rather than having that leg come forward and we're swinging it around for us to look at. So keep nice and straight. Keep looking forward and lifting up like so, and really feel the exercise, and you'll feel it in that muscle there. And then the last one after the lateral leg raise, we've got what we call the bird dog. Now this one's a fun one. We're on our hands and knees. You can see the wrists and the elbows and the shoulders are in a nice straight line and they're over the top of each other. Our knees are directly underneath our hips and our back's in a nice neutral position. Alright? If you do get sore wrists, sometimes people can do it up on their fists, and that makes things a little bit more comfortable if you do get that little bit of achiness when you're in a flat hand position. And then also with the back, we don't want to be too arched, we don't want to be too flexed. We want to have our head in a nice neutral position as well. So find that sort of nice neutral there, really sort of sticking the bum out, making sure we're nice and square. And then again, it's the opposite of the dead bug. When we're in the dead bug, we did the opposite arms and opposite legs. And this is exactly what we're going to do here with the pointer exercise as well. So we reach out with one of our arms as if we're trying to reach towards the wall there. And we reach back with our leg. And we really reach and hold in that type of position there. Hold there for about another 3 to 5 seconds. And then coming back down. And then reaching out and coming back down. Okay? As we get better, we can just alternate and reach and hold. Okay? And you'll notice when I do that, if I was on the floor now, my toe would be skimming along the floor.
I'm not lifting it right up in the air and arching my back and doing all these types of things. We're really just reaching as straight as we can, hence the reason they call it a bird dog, because a bird dog would point to where the bird is and then coming back down, and then we alternate back and forward. So we perform around about 10 of those, keeping the core on whilst we're doing it. Of course, activating the pelvic floor throughout all of these exercises is a must, and basically all of those things should only take us around about 4, maximum 5 minutes to actually perform. Alright, so if you have any problems with those, or any of them actually cause any pain or anything like that, certainly you need to ask us here at the clinic. Give us a call and ask us exactly what you should be doing, or make an appointment and get in to see us as soon as you can. Thanks.